Now, back in Israel, the Jewish state thankfully still considered a green country. But coronavirus infections are back on a fairly consistent rise, so authorities are yet again increasing measures to prevent a fourth wave outbreak. Channa Rifkin with the details.
Israeli hospitals bracing for impact, expecting a potential fourth wave of COVID-19 infections and hospitalizations. One health official even telling Israeli media on Wednesday that, quote, the medical teams are already exhausted, having not yet recovered from the previous waves, and they're worried that they may not be able to stand another hit. But the hit's likely coming. 723 students, for one, now sent home from the Einstein School in Petach Tikva after 20 kids tested positive for the virus. Parents of an infected student sent her to school despite her being mid-quarantine. And a father of one of the newly infected now threatening legal action over the apparent case of negligence. Likewise, the school's PTA head, Yifat Levy, condemning the decision as an irresponsible act. Meanwhile, efforts to combat the spread reawakening too. Teen vaccinations, for example, seeing a 500% increase over the last few days, under pressure from Prime Minister Naftali Bennett and Israeli health authorities to help contain the new Delta variant. And Bennett adding that Israel is in a race against time, with massive caches of vaccines set to expire in a month's time. Then, in attempts to prevent further COVID carriers from entering the country, Ben Gurion International Airport pioneering a segregation plan for separating travelers by the country they arrived from. The order coming from Transportation Minister Merav Michaeli, who suggests using one terminal for travelers coming from red countries and another for all the rest. Further, the ministry is also increasing shuttle operations within the airport to reduce crowding, especially amid reports of massive lines of people waiting to get mandatory PCR tests.